So,
It could be you and the client though, if you're kneeling on top or something like that.
so the next stretch in lying position. So you have to bear with me. Some of these have to actually read through to make sure that I'm doing the one that is next. So this first one is position height. Right hand or the dominant hand is going to be underneath the client's neck and the occiput. The inferior or non-dominant hand is going to be underneath the chin again. Okay, so that same thing that we were doing before. And she's gonna bite down, so her tongue's not in the way, and then all I'm gonna do is pull back evenly, just slightly. I'm not trying to, again, not trying to gain 2 inches here. I'm just trying to put some traction in that spine. And what I like to do is I'll look at about her waistline and see if that's gonna move. And if that doesn't move, then doesn't mean I'm going to go more. I just want to see if there's a sticking point anywhere else. And then I'll hold for a bit. And then when I let go, I'll see what else moves. So when I first moved, waist didn't move very much. So this is probably just more of a thoracic opener than anything else for her. My pressure is, I really feels like I'm about 70% on the back of the head and maybe 20 or 30% on the front.
How long are you holding these for?
Maybe 30 seconds to a minute and a half, 2 minutes. I mean, if you really want to, if you have the freedom and if you really want to make some change, long time, 4 or 5 minutes.
Okay.
Minimum.
Okay.
Okay, so that is the first neck stretch. The second one is going to be, I'm going to take, it doesn't really matter. You're going to want to do this actually with both arms, rotating and stretching both sides. So all I'm going to do is, my forearm is going to go underneath the neck, and my right hand, at this point, because my right arm is underneath the neck, takes that other shoulder down. And now if I were to, I'm going to take my other hand and support her side of her head. And if I just lift up, naturally, my elbow comes up and she goes to the side. So now I'm getting a trapezius stretch, levator stretch, spleen cap, spleen cervius, Splenius brothers. And you can also do some rotating here as well. We'll do, when we do rotating, this comes into play. So a nice stretch here. Okay, and then the next one is a variation on this, where both hands come underneath their neck, both arms on top. Nice deep breath in, then exhale. I'm just gonna stand up and press down with my hands. And she will feel that in her lower back. Yes?
Not really.
See?
Yeah.
Say it. I'm just joking.
Say it.
Yeah, I can feel it more now.
You can?
Mm-hmm.
Okay. Thank you. So you're just pushing down and then you're getting a nice stretch. You don't want to go too far too fast, but what you'll find is, you know, after about 30 seconds you go a little bit farther, then a little bit farther, a little bit farther, and then the tension that you're pushing against will go away. You're starting to loosen that stuff up. You're starting to loosen the spine up, loosen the fascia up, loosen the spinal muscles up. Okay, so those are the 3 neck stretches. There is also turning of the head. Inferior arm at the base of the head. Superior hand down, so down into the table, and inferior pressure away from with the shoulder. So what I'm not doing here is pushing a lot I'm not pushing the head away. I barely have any pressure on the head. What I'm doing is actually with my right hand stopping the head from coming back and pushing with the left hand. It's much safer to push the shoulder down and apply the stretch than it is to push the head away and apply the stretch. We're getting into a lot of more precarious positions with that Atlas and C1, C2 kind of thing when we push the head away. So we want to keep the traction and pressure there a lot less. Most of this push is down here with this arm. Okay, and then you do that with both sides. So that's another shoulder stretch that you can do. Trying to find out what I get, when I can stand up. Obviously, I didn't want to go straight back. Bad news bears. Bear with me here.
Did he allow himself out?
No, he always leaves me like
Superior hand underneath the scapula. Okay, making sure that your thumb is in this kind of clavicular acromial AC joint dent that's right here. Okay, so what I'm going to do is just kind of stretch and pull up. So this hand's pulling, getting that scapula to move, and then I'm lifting up as well. And you can also bring that down. I would pivot to do that so I can use my hand or use my knees. I can bring it down this way as well. Depends what's needed.
I really feel that right here is stretching a lot.
Yep. There's a great band of fascia around these brachioradialis, all of this, this musculature that goes up through the forearm, up through the anterior shoulder, then attaches onto the sternum through the pectoral girdle. So this stretch right here, I'm kind of now going on a tangent. This stretch right here, gripping from the elbow and pulling down and getting a stretch, slight pressure down. This is awesome to hold, very non-invasive for females that come in and have really tight shoulders, anterior tilted, humerus internally rotated. This is awesome. You gotta hold it for 5 minutes or more. You gotta hold it for a long time. I did it with a client of mine, half-hour session, 5 minutes, 6 minutes actually, each side, and she said from T12 all the way up to my head, front and back feel amazingly open.
Wow.
We didn't do anything except this. So, back to the stretch.
So that
Here.
was, what was that? Just something you threw in?
Yeah. I'll go back through the Yonka stuff. The chatisms that I'll add in. But, so, you're pulling up on this shoulder blade here, the scapula, and you can come back with it. Okay, that's kind of part of the rotations, but we're just stretching. And I'm gonna interplay stretching and rotating. So when I go through some of the stretching, where I know there's an application for rotating, I'll say it, because it's good to get they work so well together that I want you to be thinking about rotating as you stretch. And we'll actually do the rotating. I'll also move and put in stretching to the rotating too, as well. So just to let you know. Okay. Yeah. I'm gonna do this one. I'm not 100% fan of it, but it does work really well. So what you're gonna do is foot right in the armpit.
Do we have
Okay.
to practice this one?
Hmm?
Do we have to practice this one?
Yeah. And then push against it, keeping in mind that your pressure needs to be pronated.
What if while you're doing this, you are not, your client just gets really uncomfortable about it? Just don't do it.
Yeah, no, absolutely not. No, you would not do it. Absolutely not. So you have to make sure that you keep this fifth toe up and in towards that seam. And I'm not gonna try to go medial at all with that pressure. Does that feel okay, Katie? Doesn't feel
Oh, yeah.
invasive at all?
No.
Feels good?
Mm-hmm.
You
This
probably
is-
wouldn't do this on the first visit.
Depends. There's a few things that I reserve for second visit, but there are people I know aren't going to come back and they're in for the quick fix. I might do this.
Cool.
But I've never done this in my own practice.
Really?
No, I could probably figure out another way to do it. And I always leave
But
the...
you look so comfortable.
Exactly, right? My back is rounded, I'm on one leg, I'm not flexible, like that hurts. And I've got my foot in someone's armpit. I mean, it doesn't exactly say, are you coming back next week? To be honest about it, but it's an amazingly effective way to do this. And I'm always barefoot when I practice, so
That would be even more awkward.
yeah, you know, what
Like,
if they come
that's
in
so
and
gender
they're not clothed? Now we have skin on skin, and it's not my hands. And I was just walking all over the floor. Just saying. So there's that one. I got that one on DVD. All right.
Right now?
So I'm putting two together because I think they're pretty much the same thing, to be honest with you. What we're gonna do is, you can do this from either side, essentially. I can do this with this arm, my superior arm pulling across, or inferior arm pulling across. Either one would work, and has worked, and will work. What I want to do is make sure that I have the other hand inside of the elbow pulling back. So I have this counter pressure here. And all I'm going to do is put my elbow in. So lifting up, coming across her body, making sure that I have a good 3 or 4 inches between my medial forearm and anything that I need to worry about. I'm going to come up with my pressure, so I'm just standing up by extending my hips, not by using my low back. And then at this point, this is a very important part, you pivot your right foot or your inferior foot back and make a C. So that you can make this very flowy. So come down and you keep traction throughout that whole motion. Otherwise, if I don't do that, this is what I'm faced with. Not a very good position. So I'll end here. And now I've shorted her a 6 inches in a range of motion that she needs to feel, especially right now in this PT state of post-surgical place. So that tracing the C is a very important part. Pulling away with this arm, pulling back with this elbow, the whole entire range. So that's the stretching. And there's a little bit of rotating as well, obviously. So if I just want to statically hold, I could.
So you're pushing away with your left
Yep, pushing down actually.
and down.
And I could just hold here if I wanted to. I could actually just hold here if I wanted to. Any of those are workable, or you could do the whole range, the whole motion. Okay?